Before a smile changes someone's life, there's always a story behind the dentist who created it. But most of those stories are never told. Welcome to Beyond the Dental Chair. I'm your host, Dr. Sayed Andaleeb Zaidi. This is a podcast where we sit down with dentists, innovators, and leaders to talk about the journeys behind their careers, the risks they took, the lessons they learned, and redefined what it means to build a meaningful career in dentistry. Today, I'm really excited to be joined by Dr. Harleen. In this episode, we'll talk about her journey into dentistry, the experience that shaped her career, and what it really takes to grow and evolve as a dentist in today's world. Dr. Helene, welcome to the podcast.
Thank you so much, Dr. Saida. I look forward to it.
Dr. Helene, would you like to tell something about yourself to our audience?
So, I'm an aesthetic dentist and I am practicing from last 15 years. And I have a practice in Delhi in the name of Meraki Dental Studio. So, most of our work revolves around smile makeovers. We do a lot of veneers and aligner cases. I'm also an Invisalign educator and also a mother of twins. Yeah.
So you have also trained at NYU, sorry, at
Yes, I
University.
did my fellowship in aesthetic dentistry from NYU. That was back in 2013.
So it was an year course or how many
So
years?
it's basically a hybrid program. So I mean, there are different modules. Some of the modules you have to do offline, and some you have to go to the college and do it, and then you have to at the end of the day give a thesis. So it's a hybrid program that you can do it along with your clinical practice.
Clinical practice. That exposure is completely different than what we learn in India.
Yeah, I think it opens your eyes to, the global platform. You see how the other nations are practicing and, what is the new technology, and it just opens your mind to newer ideas.
So how has it shaped your dentistry after returning?
When I first went there, I'm from a tier two city, from a very small city, Kanpur in Uttar Pradesh. And the practice there was very rudimentary, not to the level, the way we practice here now. So, for the first time, I saw that the practices can be big, they can be fancy, and the focus was more on the patient experience rather than just the clinical work, and that's what I wanted to bring back to India when I started my practice. So I think it provided me with that vision and with a bigger dream to come back and start a new thing.
Back in 2013, I'm sure there was not much digital dentistry going on in India. So, did you wait for the digital revolution or you started it in your own clinic?
That was actually very early on. In 2013, I did see one of my mentors using a scanner, and at that point of time, you could use a scanner just with a spray. It was not like what you do now, and the scanners used to take so much time. So, but we adapted to digital technology quite early on. Almost 6 years back, we invested into a full CAD CAM unit, and I thought that stepping into it early on will give me a
Edge over.
a better, yeah, will give me an edge. Yes.
So, like you have described your path as shaped by many small moments rather than by a single defining event. So, what was the very first moment you knew dentistry and specifically aesthetic dentistry was your calling?
So when I started on, like very early on in my career, I had a mentor. He was an aesthetic dentist, a very renowned one. And day in, day out, I was seeing all the smile makeover cases. And that's when I realized that dentistry is not about just fixing teeth. It has so much emotional value, because you can actually make a person very confident and change their lives. So that really inspired me to pursue aesthetic dentistry. There was this one case that I really remember. There was this girl, she had fluorosis, and uh, he did the veneers for her. And I could see that change in her eyes, the way she smiled and the way she felt thankful. I was like, yes, this is what I want to do for the rest of my life.
Yes. The smile of the patient is what gives keeps us going.
Yes, I think, yeah, and the the change that it brings to the patient, especially in terms of like in my practice, I've seen that a lot of people get a better career opportunity,
Yes.
or they get married or they feel more confident. So yes, that's very rewarding.
Yeah. We have seen cases, before marriage, they specifically come for smile designing and everything. Now, some of the dentists have started bride and groom practices also. Like they're
Yes,
focusing on the aesthetics of the bride and groom. It is a very booming industry right now.
yes.
So, when you started building Meraki Dental Studio, what did the early days look like? What were the biggest gaps between the vision and the reality?
So I always had this dream that my practice should be based around aesthetic dentistry. And unfortunately, at that point of time in India, the dentistry was more need base rather than the want base. It was more of just the root canals or something. And, so I think the mindset had to be changed, and the way you communicate with the patient and how you present yourself to the patient, that whole thing had to be changed. There was the initial consultations used to take a lot of time because you had to explain it to the patient. So yeah, it was just difficult starting on, without any social media or anything.
Yes. So now with digital dentistry, it has been easier to make patients understand. Uh,
Yes.
they when they can with the intraoral, I think intraoral camera is also very recent. So when they started it, seeing what is actually the problem, the conversion rate has increased a lot.
Yes, I think if you ask me, what is the biggest game changer in my practice, it has been the scanner. Because when you scan the patient and then you talk to the patient on the screen, the patient is seeing exactly what you're seeing, you
Yes.
know so the patient connects to it better, the patient understands it better. So digital dentistry that way has changed the way we practice completely. The communication is much better.
So you have gone one step further and invested in CAD CAM technology. I think it is
Yes,
still very under penetrated in Indian market because uh, digital dentistry itself, all dental clinics are still not using the scanners. So
yes.
what made you invest in CAD CAM so early, and how it changed your practice and how you deliver the care?
In my practice, we were seeing a lot of international patients. And the biggest thing that we were struggling with was the timeline. So early on, I wanted to invest into the scanner so that my timelines could have been better. But when I went to see the technology, which scanners I want to buy, then I saw the milling unit. And I had no idea that I want to buy that milling unit. But after seeing the workflow and everything, within 2 3 days, I took the decision that this is what I want to do. I don't know how I'll be able to afford it or what I'll be able to do, but I was very clear that it's going to change the workflow of our practice and increase the predictability. And that's how, we jumped into it.
And reduce the patient time also. Like when dealing with international patients, they're usually on a tight schedule.
Yeah.
So
So, I realized that digital dentistry, especially when you're working with these scanners, the CADs, there are I mean, tangible benefits of it, right? Your workflow is more predictable, there is more precision, the timeline reduces, but there has been a lot of intangible benefits. Like your patients will view your practice very differently. You
yes.
don't have to talk about yourself much. And I realized that it's not just the timeline. our workflow efficiency became so much better, because after doing the preps, immediately my technicians were seeing the scans, and if anything had to be done,
We could
then we
move
used
on
to
to it. Yeah.
do it immediately. Otherwise पहले क्या होता था, patient had to come back after 3 days, remove the temporaries, give the patient anesthesia again, do it. I mean, for a small correction there was a 3 to 4 days wait time, and probably 2 more hours of extra work. So the patient experience changes and the workflow becomes better, and the friction reduces, like I think that you will enjoy more dentistry if you don't have repeat work, if there is no friction, the patient is really happy and excited. So that's what the digital dentistry does to you. And I feel we don't talk about enough. We are just talking about the better margins and the time saved, but what about the patient experience? It's amazing.
Yeah. And they get a feeling of coming at a premium practice where they have the latest models and everything.
Exactly. I mean, you don't have to tell anybody that you are so and so. They will see your practice. They'll see the tools, and it's like a quiet thing that's going on in their mind.
It affects their psychology. Like,
Yes, yes.
so you do a lot of revision cases also, like when others have done it bad and you recorrect it. So what does that kind of work demand of you clinically, or how it affects the patients emotionally?
So these patients are emotionally very, very vulnerable, because they've had some traumatic experiences. So how we deal with them is like, I mean, I would interview these patients for a very long time and understand their expectations right, and take it from there,
Hmm.
like the emotional expectation and what they really want. You have to be very realistic about the goals, and that's how you deal with it.
Yes. So, like, listening is one of the major aspect of dealing with these patients.
Yes, of course. And especially, many a times in dentistry, you can't do 100% work.
Yes.
There are limitations. There are biological limitations. Sometimes there is no bone. Sometimes there may be some other challenge. And sometimes there may be a skeletal limitation. So, with these patients, you have to be very clear in terms of expectation building also. Like they want a change, but is it possible in their face, in their mouth, whether we can do it? So I think addressing their issues psychologically is important. Also balancing it out and putting it realistically is very important.
Yes. So, if any dentist wants to start their career in aesthetics, what do you suggest where they start from?
I would say that if they can do a course, that would be great. But the life defining moment would be that you train under an aesthetic dentist. Because when you see all those cases, when you see the conversations happening, that what you are talking to the patient, how you are deciding the length of that central incisor, or if there is a canting, then how are you managing it? That real life experience is the most important thing. Like if you can do a 1 year or a 2 year mentorship under one of the dentists, that's going to change your life. It changed my life.
Yeah. You had a mentor before starting your own practice?
Yes.
I think
3 years.
mentorship is not given much importance in these days, but it can change your life.
Definitely, I can't agree more with you.
Yeah. So you have become a mentor right now for other dentists, I believe.
Yes, yes. Well, I feel when you have the experience, you
Mm.
should share it.
Pass on to the next generation.
Yes, yes.
So, ma'am, like you have been very early adopting these technologies. How do you decide which technology to adapt? Now, with the AI coming into the dentistry, do you think, are you using AI right now?
I am using AI in some of my work processes, especially in terms of the patient experiences. I am using
Mm.
AI in terms of the clinical management. I'm using AI. And also, we are using AI for our, when we have to show the outcomes to the patient. So, in the
Yes.
first setting, we can quickly take some pictures and the scan, and we can show the outcome. And as far as deciding on the technology is concerned, so mostly I ask myself two questions: whether it's going to improve my patient experience
Mm.
or improve my clinical outcome. If it's doing one of those things, then yes, I would want to think about it. And I also think, what kind of learning I'm getting, like whenever you bring a new technology, especially for example with my cat cam, I had to spend initially 3 4 years learning that
Learning
technology. It's not that simple,
how to
especially
use the
taking of the crowns and everything. It's like a different ball game altogether. So you have to think in terms of education also.
so what are you using, ma'am? Like, can you elaborate on clinical outcome? Or what are you using AI for?
So we are using DSD, we are using ClinChecks just to show the patient outcome.
Outcomes, yes.
In terms of AI, we are using that, but most of the AI that we are using in the clinic is in terms of the patient experience. So automation of our WhatsApp messages when patients contact us, those ways we are using more of AI workflows.
Like patient recall, reminders, and everything.
We're using a lot of technology that way.
Okay. So have you started using AI voice receptionist? It is the booming thing right now.
We've thought about it, but I think the laws need to be a bit more stringent, because at this point of time, I'm a bit concerned about the patient privacy and the data breach. Because whatever calls I'm getting, a third party is getting my data also, and I'm not sure about how they are going to use that data. So at this point of time, the whole technology seems to be very, very promising, and I'm really getting inclined towards it. But for me, the data privacy is important. My patient data protection is important. So that's what just holding me back for now.
Okay. Actually, ma'am, already using automation for patient experience is a very leap ahead. Like many dentists are not that much into AI and automations
Hmm.
uh, and AI diagnostics.
Hmm.
So, are you keen on AI diagnostics? Do you think it can help dentists?
I think in a big way, especially in terms of reading and interpreting the radiographs,
Mm.
and that way it will help in a big, big way. And especially, I like what iTero has been doing very smartly, with the oral health suite. The way you can get the occlusograms, the bite analysis, we have the Niri technology and everything. So AI is coming big way, and it's going to help us.
This was stopping it. But do you think there is a chance that dentists get dependent on AI, the next generation? Like you guys have an experience of with using AI without using AI before digital dentistry, after digital dentistry. So that fundamentals are there. But how will it affect the next generation who are coming out of the college? Do you think they'll get dependent on AI for the diagnostics?
I think the next generation is going to be very smart. They would know when to use the AI and when not to use it. I mean, the AI can definitely help you in certain things, but when you're talking to the patient, you're not just, while doing the consultations, you're not just dependent on the diagnosis,
Hmm.
on the radiographs. You are depending on the signs, the symptoms, the clinical evaluation. The AI is not going to do that perfectly the way you do. And especially, I feel in terms of aesthetic dentistry, there is
Hmm.
no way AI can, replace a real dentist.
No, not replaced. Yeah, dentist might get dependent.
Dependency will come. Dependency will, but 100% dependency is
I think
not.
that it will not be valuable for the profession itself if
Yes,
dentists become
yes.
dependent.
There has to be a balance about what you can delegate and what you can't.
And our profession is based on our hand skills. So AI
Yes.
can never replace that also.
Yes, yes. Although, I mean, there are robots now, there is Luna, wherein you can do an implant placement also.
Yeah.
So, I mean, the future looks to be very, very promising, and I am sure a lot of things are going to come. But yeah, you are right. The hand skills, nobody
And
can take that. The talking skills, nobody can take that. The diagnostic skills, nobody can take that. So always look at technology as something that is going to help you, but yeah, definitely not replace you.
not replace. I think there is so much anxiety related with dentistry. So the people trusting the robots to do the right thing. I
Hmm.
think that is very, at least 20-25 years, they should get used to the robots in the house, then they will go allow them in their mouth.
Yeah, yeah. We are very far
Very far from the robotics, at least.
from that goal. Very far.
So, ma'am, you are also a Platinum Invisalign provider.
Yes.
Do you incorporate it in your aesthetic dentistry? Like
Oh, in a
which
big way.
first?
In a
Yeah.
big way. So we're doing a lot of comprehensive cases, comprehensive smile makeover cases, wherein probably we need to do some sort of alignment initially, and then do a veneer, or
Yes.
multidisciplinary cases. And there is a great tool called Smile Architect. So I
Mm.
use that to plan all these cases.
So you became the first GP in North India to achieve Platinum Invisalign provider status. So what does
Yes.
that milestone represent to you beyond the numbers?
Beyond the numbers, it's like a good reminder that of the patient's trust,
Mm.
because the numbers come only when the patient is trusting you and referring you. And uh, and the clinical outcomes, there have been great clinical outcomes, and we've been continuously investing into our education and the whole team's education. So that way it's been really good. And with the numbers, we've also gained experience doing more complex cases, managing those cases, and of course integrating the comprehensive cases like the smile makeover cases with aligners.
Okay. So how many cases does get platinum status, ma'am?
Platinum is 50.
50. Okay. So you built all this while raising twins. So were
Yeah.
there moments where you genuinely questioned whether you could do both, or how did you balance it all?
Oh, there were a lot of moments, but yeah, I think I don't believe that there is any work and personal life balance truly.
Mm.
I believe in prioritizing my day. Sometimes the work takes the priority. Sometimes the kids are more the priority. So you have to learn to prioritize your day, and have a good team. It's very important to realize that you can't be doing everything by yourself. So you have to learn to ask for help, whether it is at work or it is at home. And you learn to delegate some of the
Delhi.
jobs, and that's how you balance it out.
So dentistry is still a male-dominated field at the leadership level. Have you experienced that directly, or how has it shaped you run your practice or present yourself professionally?
Hmm. Yes. So, 50-60% of the dentists are females, but it's still ironical that the leadership is taken by the males.
Yes.
Yes. I
Statistics that only 20% of the all over the world, only 20% of the leadership is the positions are of females all over the world in major organizations.
Yes.
Women in
So
India.
I think, yeah, the girls, the females need to be more visible, and, there has to be a proper support system, and they need to take more opportunities, and feel less guilty about the balancing act.
Yes.
A lot of times there is that mom guilt. We need to
Yes.
get out of that, and we need to take more space in the room for sure. And that will happen only if our environment is supportive. If our environment is not supportive, then that's a problem.
Family support is crucial to thrive.
Family support and at work, and also I feel that females in their head, we have to tell ourselves that we can manage everything and we don't need to feel guilty about missing out on the real, the family moments or anything. It's okay.
Ma'am, in my podcast, this two things have come up really, like in every episode, like delegation and getting out of the mom guilt.
Yeah, yeah, very important because I talk to so many of my friends and everyone's like, I don't know how will we manage, who will look after the kids. I wonder why men are not thinking about it.
Yes,
They will never worry about it. Who will feed the kids? Who will educate the kids? Why we holding that guilt?
yes. Like before every decision, we keep our kids first. Like how will it affect them? Then we take the decision of our career. I think it is one of the reasons most women hold back from promotions, from
Yes.
leadership roles, because you need to give more time for that job, which
Yes.
we're already lacking running a normal life. And so leadership positions demand a lot from you, and there is
Having
time.
a very open conversation with your children also helps a lot. Like, so because I'm mentoring, so I travel a lot. So I always tell my kids beforehand that these 2 days I'll not be there. So these are the people who will be looking out after your, your timeline and everything. This is what is going to happen. So setting the expectation right with the child also is very important. And I think working women have more independent children.
Yes, and
They're
they're proud of
emotionally
their
also more
mothers.
balanced. Yes, they are. They are.
They're proud of their mothers, and they look forward to it. Like it is normal for them. They don't feel that this is something I'm having, like I have to compromise.
Yes. And I feel if you are more accomplished, you're more happy, right? And if you're happy, you can give more in your personal life. You can't pour from an empty cup.
Yes, that is true.
You have a more fulfilling relationship.
Otherwise, you'll build that resentment towards your spouse, and even sometimes with your kids, that because of them I'm unable to achieve my career goals, or I have to give up my life. So
Yeah,
having
and if you feel that even if you're spending more time with your kids because you're staying at home, but you're not happy. So
yes,
the quality of the relationship that you share with your child may not be as good.
Mhm. That is true, ma'am. Actually. So, ma'am, what does the landscape look like today for women in dentistry in India compared to when you started, and what changes need to be made?
I think it's amazing. It's full of opportunities. It lies on an individual whether you take it or you don't take it. And what definitely needs to be changed is that more females need to come out there and take more space in the room and take leadership roles
Yes,
for sure.
be outspoken about
Yes.
goals. Yes.
Yes. Being outspoken, being more visible, and feel less guilty, you know.
So, ma'am, you have been very vocal on social media.
Yes.
It was a strategy, or did it grow organically?
Uh, I mean, it just started with the when Instagram was happening. So my team kept on telling me, so many people make these reels. Why you not making it? And initially, I was like, I don't know. I don't see myself like that. And with a lot of pursuit, I was like, okay, let me start. So it happened organically. Like we never put too much mind into it. We just started sharing our work, and then we saw a very good response. And the response was not just in terms of the likes or the followers, it was definitely in terms of more phone calls for the appointments and everything. So what started organically became a strategy when we saw what could
Yes.
change. Yes.
So, which year was this, ma'am, when you started with Instagram?
uh, Social media, I would have started somewhere around maybe 5 6 years back. So we were doing, like, we always had a website when we started, but and that was 10 years back. But we were not active on Instagram, or that started 5 6 years back around COVID time.
Around yeah, best time
Yes.
to start
Yes.
new.
Okay, let's start social media.
So it has brought patients to you from India and internationally also.
Yeah, a lot of them.
A lot of them, yeah. So how do you balance being visible and accessible online, maintaining clinical credibility?
I think that happens because I have a good team. So we have a social media team who is managing our messages and everything, the content, the strategy, and everything. And in the clinic, we have very thorough processes of, we have treatment coordinators and we have associates and assistants, and everything is very well oiled machinery now.
So when you started, you built this as a one woman army.
Yes.
So what did you have to figure out alone that formal training never prepares you for?
Unfortunately, the formal training just prepares you for the clinical work. And that too, when I was a student, we just learned doing amalgams and, AFMs, something that we're not doing now. So
Yeah,
it didn't prepare us for the real world at all. But you know, so, in the real world, it's not about just the clinical practice. The practice management, the leadership, the team management, the marketing, everything matters. And the dental school doesn't prepare us for that.
mostly theory. We come out with theory of the procedures.
The redundant theory,
Yeah.
what we are not doing. I don't know what they're teaching the in today's world, but yeah.
No, actually, I just finished my PG 3 years back, and we were still doing with impression compound and border molding for complete dentures. So I think it is still obsolete. When we come out of it, we never use those materials.
And that is why I feel the mentorship is the most important thing, because
Yeah.
you don't want to make mistakes on your patients, you want to learn from the experiences and start more confident.
Indian dental education is very backward still. Like even for postgraduates, they are not teaching the latest technologies available. Even after doing post graduation, there is still a learning curve
Yeah, yeah.
for the real world. Yeah. So, ma'am, what was the hardest leadership lesson you have learned about managing a team or building a culture or running a
Yeah.
business?
So, I learned that running a practice is not just about doing the patient work, the clinical outcomes. It's more about the people, and it's more about the culture. And many at times, the people are not, aligning to your culture. They don't naturally align to it. And sometimes you have to take some difficult decisions, and
Mm.
because if they don't match to your vision, then you have to let go of some people,
Yeah.
right? And so that's difficult. And when you're managing a team, you have to make sure that, I mean, those people are also growing. Your practice will grow when the people are also growing, and you have to trust them and let them take the lead.
Creating new leaders for the practice. That is
Ye-
when actually when you can delegate your work.
yes, yes.
So, you mentioned investing in leadership, communication, and team management alongside clinical skills. So which of those non clinical investments have made the biggest difference to the practice?
Oh, it's very difficult to choose one. Um, but I think communication, I would say, if you have a way around with your words, with your patients, with your team, you do better in life. The communication has to be top notch.
I think patient communication and patient experience are the biggest differentiators in the dentistry right now.
Yeah. So, I mean, when you meet any doctor or any person, the way you feel after meeting them is
Hmm.
going to be, it's the differentiator.
Yes.
And that feeling comes with the communication only.
Yeah. Like when the patients feels that they understand me, they'll come back to you.
Yeah, yeah. For I think listening is the most important art when it comes to the consultation. You have to listen. They want to vent out, and you have to be a good listener.
I think dentistry is a part, psychological also for the patient and for the dentist. At some point, we have to deal with the whole person, not just the mouth, like what
Yeah.
they're dealing with in life and everything that affects their mentality towards dentistry also.
Because no other surgery is happening when the patient is
Is
conscious and
awake.
when the patient
Yes.
can feel everything. It's only our profession where the patient is fully conscious and you're doing 4 or 5 hour procedures, so
Mm.
that communication has to be very effective in terms of what they are expecting, experiencing, and what your expectation is. So I mean, there is no two ways about it.
So, ma'am, when was your first international patient? How did you realize that patients are willing to travel internationally?
Oh, that was long, long back. I mean, so I started my practice 10 years back. It would have been somewhere maybe 9 years back. I would have seen my first international patient.
So,
And
within
yeah,
1 year, you saw your first international case of starting a
yes,
practice.
yes. And people approached us through our website and seeing our work.
Okay.
Yeah, on the website, on the social media. And I think it helped us a lot.
So, was attracting international patients ever a deliberate strategy, or did it happen as a byproduct of the work you were putting out?
It was never a deliberate strategy. I think it just happened very organically.
Mhm.
Patient wanted another option, cheaper option, I would say, or a holiday mixed with your work, and the work that we were putting out there, and then gradually the word of mouth also helped us.
When one patient feels satisfied with your work, they'll go back home and send another one to you.
Yeah, yeah. I mean that works beautifully. And I also realized that we make a lot of video testimonials and we put it out there. So that also helps because I mean patient is believing in you, looking at those cases, looking at those positive reviews, looking at those video testimonials. They that the psychological barrier of not trusting a person goes away.
So, like they're booking a flight to come to you. So, how do you build enough trust to make someone book a flight for you?
That's what, because there is years and years of consistent, work that they are seeing. Let it be Instagram, let it be the website. There are reviews, there are hundreds of reviews out there. There are video testimonials. So it's the trust. And uh, that trust is enough for them to contact us either through email or call or whatever, and then we have a video consultation with the patient, and that initial video consultation gives them the surety that okay, they can come over.
Yes. Like you're building trust online before they even meet you.
Yes.
So, when someone flies in from abroad to treatment, the stakes are completely different.
Yeah.
There's no comeback next week. And how does that change the way you plan and deliver the care?
I think in this, two things that have really helped us is, our team. We work with a very fixed set of people, and I know who is good at what, and that doesn't change. And especially the processes that we have developed over a period of time, and the predictability that comes along with all the digital workflow. The combination of these three things have really helped us, like the processes are very set, and it's when you are doing these cases, it's not just the dentist alone. It's the
Mm.
dental assistant, is the technician who is making the veneer for you or who is doing a full mouth rehab. So we all are on one page. Everybody on my team is extremely experienced. They know what has to be done. So that has really helped us, in having the correct timelines and the predictability in the workflow.
Like having a system in place is what works.
Yes, system and people both.
Cool. Yeah. Actually, system is built by people, not the other way around.
Yes, yes. So, like, even if like a person goes, but then you'll have to train that person. So both of the things are important.
Yes. So, what does a full patient journey look like for someone traveling to Meraki Dental Studio from outside India?
from outside.
From
So
first inquiry to flying to a clinic.
So mostly when they contact us, one of our treatment coordinators would speak to them to understand what is that they want. And then most, matlab, 100% of the time, I do the initial video consultation to understand the case. And we'll ask for their radiographs and clinical pictures if they have and everything. And then we would give them an estimates and all. And with the proper timelines, with whatever they can expect, and that's how then they book the tickets and it works.
So, a lot of international cases are revision dentistry.
Mm.
So, how did that word spread to go to Meraki for revising your teeth?
Again, two things that work for us: word of mouth, because these patients who had a traumatic experience and then that moved to a good experience, they'll talk about you. They'll be so happy that they will keep talking about you and referring you more patients. And second, the thing that really changed the practice was the social media, because we have been putting so many cases of revision dentistry. A lot of people will come and tell us that we know that only you can treat this. I'm that way, so they get into that belief.
So, tourism has a mixed reputation globally. How do you position Meraki apart from that conversation?
Oh, I'm really not part of that conversation, but I the way we practice, we've been very honest about our diagnosis and about the treatment planning. I don't believe in any quick fixes, or I mean, we have a CAD CAM unit, but I still don't believe that you can do single visit dentistry for everybody, right? So I think what really sets us apart is in terms of being realistic and being honest, and setting the expectations right for the patient. And if there is something that we cannot do, then we cannot do it. We'll not accept the case just for the sake of accepting. So we are selective about our cases.
Yes, that is true. Actually, I had an experience. I met an Australian patient who traveled from Australia for the dentist here in Hyderabad. So she was saying that the price they quoted and the price they charged was way different, and it was she was not happy with the case. I was like, I'm never going back, and I'm telling others also not to come to for this clinic.
So that has never happened in our practice, that there will be a difference in the pricing as compared to what was quoted and what is being done. So that's what I'm being honest, being transparent has helped us so much that we've never been part of this negative conversation.
Being ethical, in
Yeah,
short word.
yeah, ethical,
Many
yes.
people, they'll understand that the patients will go back and they never come back. So sometimes uh,
Hmm.
they try to, include extra charges and everything else. I think it
Reputation is everything.
everything.
Um, and you should never be short sighted and just think about that immediate case, immediate money on the table. No. Always think about the long term repercussion. What is your reputation look like? And that will help you build a stronger practice.
So has treating international patients changed the way you practice?
In terms of the timelines and the processes, yes, because we've become very predictable. I mean, I know, and my technician knows that this is the timeline and this is what we'll be doing. So I think that has really changed in terms of getting the processes right.
I am sure it has raised the bar internally for local patients also. Like
Yes.
it will have a side effect on it. We don't take anyone for granted.
Yeah, I mean, see, as I said, international patients just happened organically. It's like it doesn't matter whether the patient, what is the origin of the patient. The patient is a patient, and you want to do a great outcome for everybody.
Everybody.
And the idea has always been to deliver excellence in an ethical way. I always believed in minimally invasive and ethical dentistry. When I started 10 years, I started this practice 10 years back, but that has been the core value.
So where do you see the international side of the practice going, ma'am? Is it something you want to grow more intentionally?
Intentionally, I mean, as I said, I generally don't work with there are tourism agencies and all. I
Yes.
don't work with them because I don't want anybody to push me for something that I don't want to do, you know. So I'm not strategically, I'm not putting my energy into it, but I would love it if it happens organically and through word of mouth. I would love that.
So you haven't run any paid ads or anything else other than organic growth for your international patients?
Uh, so we do run ads, that's okay, but I'm not working with
Okay.
agencies and all.
Yeah.
Yeah. Yeah.
I think most of the dentists think that working with an agency is what will get them international patients. Do you think it's true?
I mean, I know a lot of people get them through the agencies, the translators and everything, but many of them get through websites also.
So in
Everybody has a different practice, yes.
yeah. So in this day and age, having website is much important.
I
Social media presence, website, in general, online presence.
non-negotiable thing.
Yes.
Non-negotiable. We had website the day we opened the practice.
Mhm.
How will people find you? I mean, if you don't have a digital footprint, how will people find you?
Yes. No, you
Because
talk.
all is the time, when doctors used to rely just on word of mouth. Right now, when we are starting, the investments are so heavy and everything so heavy. The whole landscape has changed. So you have to be out there. Even for us, do we go to a restaurant without reading a review? We don't. Do we buy anything from Amazon without reading a review? No. How will a patient trust you if you don't have any reviews?
Yes. And video testimonials are the greatest trust signals.
Yes.
So, ma'am, you talk about resilience as one of your core lessons. So, can you share a specific setback that tested you and what it actually taught you?
So when I started my practice, within the initial 5 years, unfortunately, we had to relocate our practice thrice, and it was not easy. I mean, there were issues with the property managers and stuff, but physically, emotionally, financially, it was very draining.
Mm.
And we saw two COVID lockdowns within those initial 5 years, three location shifts, and of course, I delivered the twins, preemie twins, which was personally very challenging. So, you know, so many setbacks just when you have started is not easy, trust me. Um, but I realized that never give up attitude is very important. Whatever life throws at you, you just stay at it. Things take time, but it changes over a period of time.
If you're still standing, guy.
Yes, so resilience is the most important thing.
So, what does growth look for you now, ma'am?
Oh, growth. So I have been really, people have been asking me about my practice, whether it is in different cities, locations. So I have been now thinking about branching out. So let's see if that happens.
So, if you could go back and give your younger self one piece of advice,
Mhm.
what would it be?
When I started, I think the biggest mistake that I made was that I was not investing into marketing. I
Hmm.
did have a separate budget for marketing, and I thought that when I will make money, I will spend
Yes.
money on the marketing. I think that was the worst kind of mistake that I could have made. And to all the young dentists out there, when you start your practice, like, you have a budget for everything, the chair you want to buy, the equipment you want to buy, you should have a separate fund for the marketing, and that will really help you. That was the biggest mistake I made. So that's why I think I started very slow, and it took me many years to understand, oh, this is the mistake I was making.
Thank you, ma'am. It was a nice conversation. I think young dentists who will
Mhm.
listen to it, they will benefit. Thank you so much for coming on the podcast, ma'am. Thank you so much. Thank you for listening to Beyond the Dental Chair. If you enjoyed this conversation and learned something from it, don't forget to subscribe and share it with a colleague who might find it valuable. And remember, the most meaningful journeys in dentistry always happen beyond the dental chair.